Hello, this presentation is about oral health for people diagnosed with autism spectrum disorder. If you're interested, go ahead and find a seat and we'll get started in just a couple minutes. Alright, before we get started, I'd like to remind everyone to be kind. Somebody that is diagnosed with autism spectrum disorder could be in the room or even be a family member of somebody in the room. So please remain respectful, as any rude or disrespectful comments or discussions, jokes will not be tolerated and you will be dismissed immediately. Now that that is out of the way, let's go ahead and get started. Hello, everyone, and thank you for attending. My name is Katie Ray, and I'm graduating from Georgia Highlands College this spring with my bachelor's in health science. I previously did an internship at a dental office where I learned about oral hygiene and oral procedures. At this office, I encountered a patient who was diagnosed with autism spectrum disorder. This is when I discovered the challenges that people with autism spectrum disorder are likely to encounter, and a lot of people really don't know about them, so I'm here to spread awareness about them and share what I have learned about oral health care for people with autism spectrum disorder. It seems a little tense in here, so let's go ahead and take a few minutes and meet everyone around us, meet your peers, and share something about yourself with each other. All right, now that everyone has met and we're all comfortable, let's go ahead and get a seat. We'll start speaking about the agenda now. Today, I'm discussing the challenges and experiences with oral health care for someone diagnosed with autism spectrum disorder. I'm now going to hand out a questionnaire to assess your knowledge and experience about general oral health care and people with autism spectrum disorder. You'll have about 5 minutes to complete the questionnaire. I hope that y'all are completely honest, as it will help you throughout this presentation. You won't really have to refer back to them, but it really just will, it'll get your brain going, and it's good to be mindful. All right, I'll go ahead and be quiet so y'all can start that. Now that everyone has had time to review the questions and answer them yourselves, I'm going to open it to the floor. I'll take answers by hand. I'm going to go through them. I'll let like one or two people share per question. So, what do you know? How often should you go to the dentist? That's right. You should go at least twice a year, which is every 6 months, unless told otherwise by your hygienist or doctor. Have you ever experienced a time when you had limited ability to care for your teeth? Consider a time when you did not have the proper materials or maybe an injury that limited your abilities. So there was this one time when I broke my hand. It wasn't my right hand, it was my left hand. But I know that someone's likely broken the hand that they write with or usually brush their teeth with, and that can limit your abilities to brush your teeth. Another experience I had is I went camping with my grandpa and I left all of that stuff at home, so I was not able to brush my teeth at that time. And I woke up and it was just really gross. I did not like it at all. So let's go on and move to the next one. Do you know someone who is diagnosed with autism spectrum disorder? Okay, yep, I do too. My mother in law, she actually works in a special ed classroom, and it's just kind of brings me closer to this topic. Um, have you ever worked with somebody who is diagnosed with autism spectrum disorder? I specifically have not, but I did shadows in a dental office where there was somebody with autism spectrum disorder, and I got to really see what they experience. I said that earlier, of course, but that is the closest I've came to actually working with them. I have also, I've been in the classroom with them before because of my mother-in-law, but I haven't actually worked with them as like with an intervention. Do you know what autism spectrum disorder is? No, not exactly. Okay, we'll go over that later today. Are you aware of dental accommodations? Dental accommodations are basically anything you can do to help, whether that be sunglasses because it's too bright in the room, maybe some headphones. Sometimes they even do laughing gas. That is a type of accommodation for anxiety. It varies. And have you ever heard of a behavioral intervention before? Um, so basically, behavioral interventions are good for people with behavior issues. There doesn't really have to be any disorder. There can just be a behavior that you want to change, and that would be a behavioral intervention. Some people that might go to an AA meeting, that's the type of intervention to limit alcohol. For that type of intervention, limiting the alcohol is their goal. Let's go ahead and talk about our goal today. Our goal is to increase awareness about oral health for people diagnosed with autism spectrum disorder. Our objectives in order to complete our goal are to be able to explain common experiences for people diagnosed with autism spectrum disorder related to oral health. By the end of the lesson, attendants will be able to list 3 accommodations that can be made in dental offices to improve the experience of people diagnosed with autism. By the end of this presentation, attendants will have an understanding of behavioral interventions. By the end of this presentation, attendants will be able to name complications associated with oral health. And also by the end of this presentation, attendants will be able to recall basic oral hygiene guidelines. That last one, y'all should really pay attention to because we are going to have a little review at the end of this. So hopefully we maintain our attention and we can be able to complete all our objectives at the end. So what is oral health? Oral health is the state of the mouth, teeth, and oral facial structures that enables individuals to perform essential functions such as eating, breathing, and speaking, and encompasses psychological or psychosocial dimensions such as self confidence, well being, and the ability to socialize and work without pain, discomfort, and embarrassment. That is just a direct definition, as I am not a professional in oral health yet, so I do not want to give y'all any wrong information. However, with the help of research, which you can also do on your own, I have come up with the facts and a lot of information to present to you. So, more than 50% of children ages 6 to 8 years old and adolescents 12 to 19 have at least one cavity. More than 1 in 4 adults in the United States have untreated tooth decay. Untreated tooth decay can develop into oral infections, diseases, cancers, and even other complications. Oral diseases can lead to difficulty eating, speaking, learning, and employment, which, of course, you can see where that goes downhill. You can't have a professional appearance if there's a lot of tooth decay in your mouth, and it kind of limits people's thoughts about you, regardless of your work ethic and your work abilities. As we direct our attention to the following slide, we'll see the guidelines for good oral health by the American Dental Association. So for our general recommendations, we brush our teeth twice a day with fluoride toothpaste. Clean between teeth daily, that just means you floss. Eat a healthy diet that limits sugary beverages and snacks. This might even include energy drinks. I know when I did my internship at dental office, she said that energy drinks really, really damage your teeth. And you need to see a dentist regularly for prevention and treatment of oral diseases. That's your routine oral visits. And then there's personalized recommendations with increased risk of gum disease. They need to consider a specific mouth rinse. I know at one point I had gingivitis and I was given chlorhexidine or hexidine. I'm not exactly sure how to pronounce it, but it's a mouth rinse to help get rid of bacteria in your mouth. For patients with increased caries, consider fluorinated mouth rinse. For patients struggle to clean between their teeth, consider interdental cleaning tool. That might be your best bet. That would be an example of like a water pick or some other way to clean between your teeth. For patients seeking or needing improved plaque removal, consider a power toothbrush. The oral hygienist that I observed actually recommended power toothbrushes to a lot of her patients. And then different lifestyle considerations that they recommend is discourage practice of do-it-yourself orthodontic treatment. So like don't try to give yourself braces is what that's saying, or don't do it yourself, just go see a professional. You can recommend that patients drink fluorinated water, which, I mean, if you drink tap water, the fluoride's already in there. Discuss tobacco cessation, so you might want to consider quit smoking or using chewing tobacco. And then recommend that patients avoid oral piercings. Tongue piercings, they can mess with your gums and the overall health of your mouth, and especially with bacteria. And now let's go ahead and move on. As many of y'all have been waiting on, we need to know what autism spectrum disorder is so we can better accommodate. Autism spectrum disorder is a developmental disability caused by differences in the brain. People with autism spectrum disorder often have problems with social communication and interaction, and restricted or repetitive behaviors or interests. People with autism spectrum disorder may also have different ways of learning, moving, or paying attention. I am not a behavioral professional, so obviously this is going to be a direct quote. Common difficulties for people with autism spectrum disorder include motor difficulties, which means how fast they can move or maybe their actual physical abilities, communication difficulties, repetitive behavior, social impediments, sensitivity to change, and stimulation. Now, the sensitivity to change and stimulation is very important when it comes to oral health care, because just the tools that they use can really trigger somebody with autism spectrum disorder, which is why a lot of them either are not seen or avoid the dentist at all costs. Autism spectrum disorder is also pretty prevalent. 1 in 44 children are diagnosed with autism spectrum disorder. Autism spectrum disorder is diverse, and no two people with autism spectrum disorder are the same. Autism is incurable, but it is treatable with intervention. And the prevalence of diagnosed autism has increased over the years, whether that is due to better testing to actually identify, or if there is actual a medical and genetic reason for this. So what does this look like in the office? There's a tolerance difficulty at home and professional care. Sensory processing, which is also with the tolerance difficulty. Communication barriers. Not all people with autism are communicating. Some people are nonverbal. Some people like to read or point. They communicate. Some of them might communicate differently. Uncooperative behaviors. Some people with autism spectrum disorder, especially if they're higher on the spectrum, you might see them kicking, fighting, throwing a tantrum, which can be a risk for the medical professionals that are present. And finding a willing dental professional to provide services. Only 40% of general dental practitioners stated that they would work with someone or with children with autism spectrum disorder. So these are all really big challenges that people with autism spectrum disorder face for oral hygiene. With these challenges, there's also risk. People with autism spectrum disorder are at more risk for cavities and tooth decay, gum disease, self-injury, and discrimination. As we said on the slide before, only 40% of dental practitioners will see a child with autism spectrum disorder, which that leaves them at even higher risk for cavities, gum disease, and then for self-injury later in life because they are not treated in a way that they are going to be able to become tolerant in the dental office. So, with all of that, does anyone have any idea how we can help people with autism spectrum disorder be helped to better maintain their oral health? All of those are great ideas. Let's talk about it. Some ideas that I have come up with are behavioral interventions, occupational therapy, increased access, and accommodating offices. I believe that all of these are a way for better oral health for people with autism spectrum disorder. We're touching back on behavioral interventions. So, behavioral interventions are meant to address the function and efficiency of problem behaviors and promote the development of alternate skills. Many people are referred to behavioral interventions when their behaviors interfere with independence. While behavioral interventions are not specifically for people with autism spectrum disorder, they typically prove to be efficient and really work well with people with autism spectrum disorder. A behavioral intervention could be appropriate to promote orally hygienic behaviors without causing any adverse reactions. Behavioral interventions are defined as an effective treatment method for individuals with autism spectrum disorder. With the help of behavioral professional and the knowledge of how to improve oral health, people diagnosed with autism spectrum disorder can achieve better oral health. Behavioral interventions might look like maximizing your structure, expectations and rules, student engagement, acknowledge appropriate behavior, and responding to inappropriate behavior. Our next accommodation could be occupational therapy. Occupational therapy helps people be physically able to do everyday tasks through assessments, interventions, and therapeutic services. Occupational therapy has been proven to aid in the ability to perform orally hygienic tasks. During occupational therapy, one might work on improving strength, coordination, mobility, and tolerance. This might include methods to modify materials that are used or appear to be completely unrelated. This might look like putting a tennis ball on the end of a toothbrush to make it easier to handle. That's the type of modification that you might see in occupational therapy, which you'll see that example in this image where they used a rag and they also put the tennis ball on the end of the toothbrush. You see a lady standing next to the older lady brushing her teeth over a higher sink, and also the ball that can help with motor skills in your hands. We know that access to care is limited by financial hardships, limited qualified dental professionals that are trained to work with patients that have autism, and even limited willing dental professionals, whether they are trained or not trained with people that have autism. Improved access might look like incentives for medical professionals to be trained to work with autism spectrum disorder, additional training for the dental staff, accommodations. Tell people about the accommodations that you offer sunglasses, headphones, whatever accommodations they offer for people with autism spectrum disorder. Interprofessional collaboration. They should work with people that specialize in autism spectrum disorder so they can further provide best care, and also funding programs to minimize the financial hardships. As for existing accommodating offices, there's not very many. Unfortunately, it can be a burden to the provider as they typically cost more time and money. According to a survey of Special Care Dentistry Association members, the majority of dental practitioners also reported that financial compensation was inadequate when treating patients with ASD. Due to the cost of time and money that accommodations would cost, current funding practices de-incentivize practitioners from serving this population. However, accommodation in offices might look like providing headphones and sunglasses or advising to bring their own. Seating accommodations, like allowing the patient to remain in a wheelchair rather than transferring them to the dental chair. Offering other measures such as sedatives, restraints. You can discuss your risks with restraints and general anesthesia. This is kind of an ethical area where you would definitely have to bring in other professionals. Allowing more time to explain or allow a patient to get comfortable in the dental setting would also help. In the last hour, we have discussed oral health care, why it's important and what it is, oral health recommendations, possible complications of neglected oral health care, autism spectrum disorder, the relationship between autism spectrum disorder and oral health, and the potential solutions for people with autism spectrum disorder that are looking to improve their oral health. So let's test your knowledge. I hope you've been paying attention. Tell me a common experience that people diagnosed with autism spectrum disorder encounter related to oral health. Name 3 accommodations that can be made in a dental office to better serve people with autism spectrum disorder. What is a behavioral intervention? How can it serve to help this population with oral health? Name a few complications that can result from poor oral health. Recall at least 2 of the ADA basic oral hygiene recommendations. This was when we had the 3 different screens and there was recommendations for various levels of oral health. Those were all great answers. Thank you all for attending. You are a great audience, and I hope you have all learned something today. And remember, be kind. I'll be here for about another 5 minutes if anyone has any questions or would like to discuss any of their own experiences. Y'all can mingle among each other or come up to me. Either is fine. Here you will find all of my sources. If you're interested in doing your own research about the topic, these are some of the helpful sources that I have found.